How to avoid female infertility. According to the American Society for Reproductive Medicine, ASRM, age, smoking, sexually transmitted infections, and being overweight or underweight can all affect fertility. In broad sense, acquired factors practically include any factor that is not based on a genetic mutation, including any intrauterine exposure to toxins during fetal development, which may present as infertility many years later as an adult. Tobacco smoking is harmful to the ovaries, and the degree of damage is dependent upon the amount and length of time a woman smokes or is exposed to a smoke-filled environment. Nicotine and other harmful chemicals in cigarettes interfere with the body's ability to create estrogen, a hormone that regulates folliculogenesis and ovulation. Also, cigarette smoking interferes with folliculogenesis, embryo transport, endometrial receptivity, endometrial angiogenesis, uterine blood flow, and the uterine myometrium. Some damage is irreversible, but stopping smoking can prevent further damage. Smokers are 60% more likely to be infertile than non-smokers. Smoking reduces the chances of IVF producing a live birth by 34% and increases the risk of an IVF pregnancy miscarrying by 30%. Also, female smokers have an earlier onset of menopause by approximately 1 to 4 years. Sexually transmitted infections are a leading cause of infertility. They often display few, if any, visible symptoms, with the risk of failing to seek proper treatment in time to prevent decreased fertility. 12% of all infertility cases are a result of a woman either being underweight or overweight. Fat cells produce estrogen, in addition to the primary sex organs. Too much body fat causes production of too much estrogen, and the body begins to react as if it is on birth control, limiting the odds of getting pregnant. Too little body fat causes insufficient production of estrogen and disruption of the menstrual cycle. Both under and overweight women have irregular cycles in which ovulation does not occur or is inadequate. Proper nutrition in early life is also a major factor for later fertility. A study in the U.S. indicated that approximately 20% of infertile women had a past or current eating disorder, which is 5 times higher than the general lifetime prevalence rate. A review from 2010 concluded that overweight and obese subfertile women have a reduced probability of successful fertility treatment, and their pregnancies are associated with more complications and higher costs. In hypothetical groups of 1,000 women undergoing fertility care, the study counted approximately 800 live births for normal weight and 690 live births for overweight and obese and ovulatory women. For ovulatory women, the study counted approximately 700 live births for normal weight, 550 live births for overweight, and 530 live births for obese women. The increase in cost per live birth in anovulatory overweight and obese women were, respectively, 54% and 100% higher than their normal weight counterparts. For ovulatory women, they were 44% and 70% higher, respectively. Exposure to radiation poses a high risk of infertility, depending on the frequency, power, and exposure duration. Radiotherapy is reported to cause infertility. The amount of radiation absorbed by the ovaries will determine if she becomes infertile. High doses can destroy some or all of the eggs in the ovaries and might cause infertility or early menopause. Chemotherapy poses a high risk of infertility. Chemotherapies with high risk of infertility include procarbazine and other alkylating drugs such as cyclophosphamide, ifosfamide, busulfan, melphalan, chlorambucil, and chlormethine. Drugs with medium risk include doxorubicin and platinum analogs such as cisplatin and carboplat. On the other hand, therapies with low risk of gonadotoxicity include plant derivatives such as vincristine and vinblastine, antibiotics such as bleomycin and dactinomycin, and antimetabolites such as methotrexate, mercaptopurine, and 5-fluorouracil. Female infertility by chemotherapy appears to be secondary to premature ovarian failure by loss of primordial follicles. This loss is not necessarily a direct effect of the chemotherapeutic agents, but could be due to an increased rate of growth initiation to replace damaged developing follicles. Antral follicle count decreases after 3 series of chemotherapy, whereas follicle-stimulating hormone, FSH, reaches menopausal levels after 4 series. Other hormonal changes in chemotherapy include decrease in inhibin B and anti-Müllerian hormone levels. women may choose between several methods of fertility preservation prior to chemotherapy, including cryopreservation of ovarian tissue, oocytes, or embryos. Anti-sperm antibodies, ASA, have been considered as infertility cause in around 10 to 30% of infertile couples. ASA production are directed against surface antigens on sperm, which can interfere with sperm motility and transport through the female reproductive tract, inhibiting capacitation and acrosome reaction, impaired fertilization, influence on the implantation process, and impaired growth and development of the embryo. Factors contributing to the formation of anti-sperm antibodies in women are disturbance of normal immunoregulatory mechanisms, infection, violation of the integrity of the mucous membranes, rape, and unprotected oral or anal sex. Adhesion secondary to surgery in the peritoneal cavity is the leading cause of acquired infertility. A meta-analysis in 2012 came to the conclusion that there is only little evidence for the surgical principle that using less invasive techniques, introducing less foreign bodies, or causing less ischemia reduces the extent and severity of adhesions. A review of type 1 diabetes came to the result that, despite modern treatment, women with diabetes are at increased risk of female infertility, such as reflected by delayed puberty and menarche, menstrual irregularities, especially oligomenorrhea, mild hyperandrogenism, polycystic ovarian syndrome, fewer live-born children, and possibly earlier menopause. Animal models indicate that abnormalities on the molecular level caused by diabetes include defective leptin, insulin, and kisspeptin signaling. Non-gastrointestinal symptoms of celiac disease may include disorders of fertility, such as delayed menarche, amenorrhea, infertility or early menopause, and pregnancy complications, such as intrauterine growth restriction, IUGR, small for gestational age, SGA, babies, recurrent abortions, preterm deliveries, or low birth weight, LBW, babies. Nevertheless, gluten-free diet reduces the risk. Some authors suggest that physicians should investigate the presence of undiagnosed celiac disease in women with unexplained infertility, recurrent miscarriage, or IUGR. Significant liver or kidney disease. Thrombophilia. Cannabis smoking, such as of marijuana, causes disturbances in the endocannabinoid system, potentially causing infertility. Radiation, such as in radiation therapy. The radiation dose to the ovaries that generally causes permanent female infertility is 20.3 grays at birth, 18.4 grays at 10 years, 16.5 grays at 20 years, and 14.3 grays at 30 years. After total body irradiation, recovery of gonadal function occurs in 10 to 14% of cases, and the number of pregnancies observed after hematopoietic stem cell transplantation involving such as procedure is lower than 2%. There are many genes wherein mutation causes female infertility, as shown in table below. Also, there are additional conditions involving female infertility which are believed to be genetic, but where no single gene has been found to be responsible, notably Mayer-Rokitansky-Kussner-Hauser syndrome, MRKH. Finally, an unknown number of genetic mutations cause a state of subfertility, which in addition to other factors such as environmental ones may manifest as frank infertility. Chromosomal abnormalities causing female infertility include Turner syndrome. Oocyte donation is an alternative for patients with Turner syndrome. Some of these gene or chromosome abnormalities cause intersex conditions, such as androgen insensitivity syndrome. Hope this video is useful to you.